We're going to pick up right where we left off this segment, and we're going to bring back in right now Ellis Henican and Niger, Innis. Guys, we were talking about how Ebola is being used in this election cycle. These midterms are crucial. The president, the administration, not looking too great right now, getting a lot of criticism about how they are handling the operation. You saw Joni Ernst there talking about Bruce Braley, a current congressman, saying they're not doing enough. This is really a difficult spot, Ellis, for Democrats to try and defend themselves against these types of questions.
How easy it is, John. First of all, panic is an effective political weapon, right? Politicians know how to scare people, and sometimes that motivates votes. But let's look at what's happened here. The huge screw-up was at a private hospital in Dallas with non-union nurses receiving no support at all from the pharmaceutical industry in this country. And the solutions are coming from the National Institutes of Health and the CDC. The main complaint against the CDC, as I hear it, is that they aren't there quickly enough. So let's let the government help us out here. Don't cut their funding. Bruce Braley made a very good point. Republicans have spent the last few years trying to slash research funding, healthcare funding, funding of just the very agencies that we're now turning to and pleading for help. So this thing is absolutely the perfect argument for why we need a strong public health system and why sometimes, not always, but sometimes our private healthcare system lets us down.
Ellis, you should be advising Mark Pryor perhaps, but let me ask Niger to follow up there. You know,
I'm not sure what you meant by that, John, but go ahead.
He really struggled. He was asked a question about the president's handling of this, and he really struggled to answer that. But we'll move on, and we'll ask Niger about the response to what Ellis just said. You know, a lot of Democrats do fault Texas, Rick Perry's Texas, for having some of the highest rates of uninsured there in the state, and they question how health care is run down there. What do you think about Ellis and Democrats using this to combat what Joni Ernst was saying?
I think it's a total canard. The fact of the matter is in the I believe it was the 2011 or the 2012 budget that was affected by the so-called sequester. Obama asked for less money than the Republicans in Congress ended up giving the CDC. The problem is not a question of too much or too little money on these government programs. It's the question of priorities and how the money is spent. The fact of the matter is the CDC is engaged in programs. They have enough money to engage in irrelevant programs like the institution of marriage and how is happiness defined in the institution of marriage, which has nothing to do with what the Center for Disease Control should be doing. And, you know, you can blame the private institution, and, of course, there's plenty of blame to go around with this crisis, but there's a real problem when a nurse had the intelligence of mind to call the CDC and say, hey, look, I've got a fever, and by the way, I was in contact with the man who died from Ebola, and they said, okay, go ahead and fly in a plane anyway. So that's not a budget question. That's a question of priorities. And here's the bigger one. The bigger one is there's some bad decisions that are coming from Barack Obama and trickling down. For example, why no travel bans? Of course, it is a no-brainer that we should have travel bans. You know, I'm going to call it the Nigerian miracle. Nigeria is the largest African country by population. It is also in that region of Liberia and Sierra Leone where there have been 4,500 deaths. In Nigeria, because they have had tight border security, because they've had travel bans, there have only been 20 deaths in this huge African country. You know, and the reason they're able to do it and we're not is a little thing called racial political correctness. If this disease was not born in West Africa but was born in Bosnia or born in the Ukraine, I guarantee you there would have been travel bans. There would have been much more of an affirmative action on the part of CDC. It's not a question of how much money or how little money the CDC has. It has plenty of money. It's a question of priorities.
All right, Ellis, we only have about 15 seconds left to go. I wanted to get your response. Do you think Niger is right that if this disease had originated from Eastern Europe, their travel ban would already be in place?
I'll give you a one-word answer. That's ridiculous. I don't have time to refute all of Niger's long comments there, but you know what? When we have a health crisis, let's listen to the health officials in the same way, Niger, that we listen to the military officials when we go into war.
All right, Ellis, we got to leave it there. We're taking a break. We're back with more here on America's Forum.